Thank you and Ms. Miller for waving on to the committee today to be a part of it. You're not part of the subcommittee, but it says a lot that both of you wanted to be here. So thanks for your patience, Greg, and being here and for sticking around.
Yeah, of course. And thank you for allowing me to wave on to talk about a bill that I've worked on that's important to the state of Florida and homes that we have. And I'll talk briefly about the Florida Sheriff's Youth Ranch. But I want to thank you for the opportunity to speak in support of H.R. 3852, offered by myself and Mr. Dunn of Florida. This bipartisan bill, H.R. 3852, the Creating Accountable, Respectful Environments for Children Act, addresses the shortage of foster home options for children by allowing cottage homes to be eligible for federal funds that other programs already have access to. This bill is simple, straightforward, and direct. The bill simply adds cottage family homes to the options of federally supported housing for foster children. Make no mistake, our country is facing a foster care crisis. Mr. Chairman, I'd like to enter into the record a recent news article entitled "Inside America's Critical Shortage of Foster Homes," which reads, "There's a critical shortage of foster homes. More than half of all states saw a significant decline in licensed foster homes last year. Some states saw cuts as high as 61%.
Without objection.
I'd also like to enter into the record an NPR article titled "Kids Housed in Casino Hotels." It's a workaround as USC's decline in foster homes.
Without objection.
Casino hotel rooms, is that really the best option for our children? Cottage family homes offer a family-like living environment in a single-family residence with no more than 2 children per bedroom unless it is in the children's best interest. For example, in the case of keeping biological siblings together. The cottage parents can supervise and nurture around the clock, creating a healthier, stable environment. Critics of this bill attempt to tint the good deeds of this model by incorrectly asserting cottage homes are not safe. Make no mistake, the safety, health, and general well-being of children is critically important. My bill stipulates requiring the implementation of a trauma-informed approach to care, prohibiting the use of seclusion, mechanical or chemical restraints, requiring providers to have a system in place for children to alert a staff person if they have concerns or feel that have been unfairly denied their rights, requiring continuous quality improvement methodology that regularly solicits information from children concerning their perceptions of the quality of care. I have the honor in the state of Florida, we have Florida Sheriff's Youth Ranches, and I've seen firsthand, my family's in law enforcement, my brother's a deputy, my father's a former sheriff, and seeing the impact that it's had on kids that have been a part of these group homes, these cottage homes, where there's a parent, family, familial unit that is taking care of multiple different kids. And the kids tend to be a little older, not your younger kids, your kids that have trouble in middle school or high school. And it's just a great environment. It lowers recidivism rates and has great outcomes. And to not include them in federal funding, I think, is a mistake and an opportunity to be able to close this gap on the 61% of the need in foster homes. The time is now to solve this crisis. I look forward to working with the subcommittee to pass this bill and protect our children. I appreciate your time, and since I have 2 minutes left, quickly I'll ask Ms. Markhart. Thank you for sharing your experience as a caseworker. We know caseworkers have a challenging job and often receive little recognition. What do you think some of the common misconceptions or challenges are that caseworkers specifically face, and how can Congress better support them in the child welfare system?
Thank you for your question. I think the best way to support the caseworkers is by, one, trying to retain staff, and the best way to do that is to be able to provide better training so that people are more prepared when they're coming into that position, and then additionally providing mental health services so that when they are feeling burnout and they're on the verge of that, they're able to get that appropriate care so that they do have the ability to continue to provide appropriate services for the children.
Thank you. And in the minute I have left, Mrs. Carr, I'll yield to you since I'm the last person to speak on the dais. If there's anything you'd like to add to the conversation in 52 seconds, you've got the floor.
Oh, how fun. I wish I was at my family dinner table and got that. No, I just want to say an enormous thank you to all of you for your engagement in this issue, and Chairman, to you and your team for pulling this together, Ranking Member Davis for your longstanding commitment to this work. It really means a lot that you've held this hearing today, so thank you.
I yield back.
Thank you, Mr. Steube, and we look forward to working with